welcome to the second episode of COVID Shots, a foster feed series of 4 episodes concerning the second wave of COVID pandemic that has already hit India. In today's episode, we will be learning how to prevent corona infection from our very respected professor, Dr. Abhishek Ghosh sir.
Welcome back, sir. So, can you
Yes,
please tell us what are the general preventive measures that everyone should follow?
yes, that's so general measures means nothing but actually maintenance of personal hygiene, which is known to all, but we follow less. Actually, COVID infection has brought back those practices, which is good to follow always. So always use hand sanitizers. Carry hand sanitizers with you. Preferably, you should carry a one small bottle of liquid soap. When you are touching some suspicious thing, better to wash your hands with soap. That is, and remember, for soap or alcohol sanitizer use, wash or rinse your hands at least for 20 to 30 seconds, so to kill the virus adequately. Otherwise, it is not going to kill you, and actually you can have a false confidence that you have washed your hands, but still you can have infection because by you have not given enough time for those soap or hand sanitizers to work. And also, as the transmission rate of these new virus strains are high, so try to maintain or try to keep two masks always with you, and you may carry some one mask reserve, because often if a mask can get spoiled due to any reason, you should not use that mask. And that's preferably you should carry 3 or 4 masks with us. Two on, of course, we have to be used simultaneously, and preferably one should avoid a cloth mask that is not going to help you to for prevention. Better to use two surgical masks or one surgical mask and one N95 mask. Two N95 masks are better to advise, but it is not for practical to wear those two 95 for
In
a
the
long time,
hot
because that
and
will
humid weather.
cause your significantly respiratory stress can happen, because that um, so N95 and one surgical mask is enough to prevent you from the getting coronavirus. And of course, avoid
So,
distancing.
why vaccination?
Why vaccination? Yes.
So, why
Good.
vaccination is so important?
Yes. So vaccination is the actually only way by which we can generate adequate antibody response to this against this COVID vaccine, COVID virus. Coronavirus has itself got no treatment. So all that some agents are there like ivermectin, doxycycline are used that can sometimes have some studies have shown that they reduce the viral load. But actually, to cure, you have to get enough antibody response, and that is possible only by giving some vaccines. So vaccines are important because that will actually, if you get infection also, so it is a common myth that after vaccination we do not get infected, but that is a myth actually. So you can get infection if you do not follow the proper safety measures, but if you are vaccinated with double dose, and then chance of severe infection is less and chance of hospitalization is also less. It is not that it is absent risk, but there is a risk, much less risk. So get vaccinated early to and previously, though this year we have lost a few healthcare workers and doctors, but the incidence you will find that it is much less than the previous year. Previous year, many doctors and healthcare workers have lost their life because they are not vaccinated. But as most of the doctors and healthcare workers have now vaccinated with double dose, the chance of infection, at least severe infection and death, is also less. So that is a learning point for all, that if we are get vaccinated, then we are better cured, we're better protected from getting the serious infection. And nowadays there is a shift of uh, patient from older to younger, because older are vaccinated, at least they have received one dose, and that is also going to protect them to some extent. At least 50 to 70% protection is there after this first dose also, and after second dose there is a prevention protection from for at least close to 90%. So yeah, as we are getting sad because most of the younger patients having high oxygen demand, they are desaturating early. But this reason is that they are not vaccinated. So vaccinated people, they are the older people, they are getting less infection this year, and non-vaccinated people are mainly younger. That's why they are getting infection. So that is the learning, that if we are vaccinated, then probably we are getting the chance of hospitalization is less, and chance of severe infection is also less.
Okay, sir. As of now, there are two vaccines available, Covishield and Covaxin. So, which
Yes, yes.
vaccine should one go for?
So Covishield and Covaxin, also Sputnik 5 is also licensed for giving in the India. Mm, so actually, Covishield, for Covishield has come in the market for a longer time, and for Covaxin has followed it. But so there are, these are the two different kinds of the vaccines. Covaxin is the killed vaccine, and Covishield is a vector adenovirus vector borne vaccine. So chance of better protection is actually, I think one should not hesitate to take one or should not prefer to take Covishield or Covaxin, because vaccine availability, that is most important. Whatever you are getting, you should take it as early as possible, and of course you have to maintain take the second dose also same vaccine. So if you are receiving Covaxin as first dose, of course you need second dose of Covaxin is only. Covishield also is first dose Covishield means second dose also should be Covishield. But we find here that Covishield availability is little bit better than the Covaxin, because nowadays there is a common problem that Covaxin, who have got it first dose vaccinated with Covaxin, as Covaxin is not available, they are getting a little bit really trouble, because Covaxin second dose is not available now. So dates times are passing by and it is not available. So try to get the better available vaccine, because ultimately you have to plan the second dose also. When you are giving the first dose, you have to plan the second dose also, and then better available vaccine, that is Covishield, is little bit preferred here, as at least at this present moment, because
Due to the
Covaxin
availability.
second. Yes, due to the availability. Otherwise, for safety and efficacy measure, both are almost equivalent. So nothing to choose for. And but there is some data of Covishield, which is that there some, especially some problems of the some patients with who are taking the anticoagulants, having coagulation abnormality. So for those, Covishield has some reports of getting cause thrombosis, but that data is not enough in the, or not quite common in the Indian. So there is also myth that Covishield should not should be avoided in such patient, but that is very rare incident. Some reports are there, but that is also very rare. And but if we follow the normal other drugs, follow the your physician's advice, do not avoid vaccination. We should always vaccination. If unless there is severe contraindication, we can uh, continue the vaccination, or you can we have to do vaccination, because unless at least 60 to 70% of the Indian population is vaccinated, vaccination will not be helpful, because actually with this vaccination, there we can or we can hope for a better India with less infection. Otherwise, if we only 5 to 10% vaccinated, that is not going to help much, because once again, from the next unvaccinated people, infections will get transmitted to the other parts. Uh,
So, when should one take the second dose of vaccine if he gets COVID infection within 4 to 5 weeks of his first dose?
yes, that is a very common scenario now we are getting. But hopefully, the first dose, who have received the first dose, the infection severity is less. But yes, so when vaccines arrived in the market, they told that who have got past COVID infections, they should avoid at least 4 to 8 weeks after getting cured from the COVID. So same applies here also. If you are getting COVID infection of the first dose, we should wait for 4 to 8 weeks. I know that that is outside the time frame of the getting this Covishield of, because Covishield has time frame of getting second dose vaccine after 6 to 8 weeks of the first dose, and Covaxin it is given 4 to 5 weeks after first dose. But if you are getting infection in between, then we have to wait for at least 4 weeks or from getting after getting cured, because yeah, because this COVID infection also producing your some antibody, and vaccine also produces some antibody. So if you are giving the Covaxin or Covishield just after getting COVID infection, then antibody response due to vaccination will not be adequate. That's why you are advised to delay some at least 4 to 8 weeks and then get the second dose.
Okay. So, when does the antibody develop after taking the second dose of vaccine?
Mm. And that is also little bit different for different vaccines, but for the Covishield and Covaxin, it almost take 8 to 12 weeks to develop adequate antibody response. But that is a question: how long this antibody will be present in adequate amount after the second dose? That is a research thing, and there is no answer right now. We have to wait, but probability is that an antibody response, though antibody titer may not be present in adequate amount after long years, but as this Covishield has T cell immunity also, and that can memorize the previous infection, and with that can generate the antibody if needed. So if the vaccine if it has some impact on the T cell memory, then that vaccine can serve the future infection also better. And despite having low antibody titer, that will have some protection against the new infection also. But probability is that again we may need some booster dose to increase our antibody titer. But when we need this booster dose, that is still a question. We do not have adequate data. Probably uh, within next 1 or 2 years we can have that information.
Okay, sir. So, what are the contraindications of vaccination?
Yes. So vaccine contraindications are not significant. We should not get panic. And there is a daily phone calls coming that whether we should take vaccine, whether we should not take vaccine. So that should be clear in mind that we have to take vaccine unless there are some serious contraindications. So what are the serious contraindications? Hmm. So who should not take the vaccine? No person below the age of 18 should not take the vaccine. Actually, it is not contraindicated, but actually data is lacking. That's why, just like we should avoid the pregnancy vaccine in pregnancy, we should avoid the vaccine in below 18 years. And pregnant and lactating women should not be administered the COVID-19 vaccine. This is because women who are pregnant, lactating, or expecting pregnancy confirmation have not been part of any vaccination trial. But in lactation, as I have mentioned that healthcare workers or frontline workers who are contacting the COVID cases, they can be vaccinated. Anyone who has an anaphylactic or allergic reaction to a previous dose of first dose of COVID vaccine, they should not receive the second dose. But that is incidence is very less. Anyone who has immediate or delayed onset anaphylaxis or allergic reaction to pharmaceutical products or food items should not take the vaccine. Okay. So mainly some food allergy, some drug allergy may be present, but some food allergy, if they are significant food allergy, not a mild one, then they should avoid the vaccine. Those number 5 is that those who show active symptoms of COVID-19, they should not take must delay the vaccine, because often there is a confusion that if I am having symptoms just now, fever, body ache, mild cough. If I take vaccine because my vaccination date is already scheduled, and if I get vaccine, then we get protection. But that is a false conception actually. But if you have having COVID symptoms, we have to delay for the vaccination. We have to take vaccination after 4 weeks of recovery from those COVID symptoms. So ongoing COVID symptoms, they should not be vaccinated. That's the important contraindication we should remember. Number 6 is that anyone with acute illness or hospitalized should not take the vaccine. Now they can take it 4 to 8 weeks after. So any critical illness patients, they should avoid taking vaccination immediately. They should wait for 4 weeks, because once that the same thing, because in critical illness patients, where often they are immunity is suppressed, so adequate antibody response against vaccination may be not adequate. That's why we should wait for 4 to 8 weeks. Next is that Covishield should be given with caution for to those with thrombocytopenia and some bleeding abnormalities, but that is a caution, not a contraindication. Okay.
Okay,
So
sir. So, what are the possible complications of vaccination?
yes, possible complications are also expected because of course, as this is a foreign object, there is a chance of course there is anaphylaxis or allergy, and there is some injection site pain, and often patient complaints of fever, myalgia, body ache, headache for next 2 to 3 days, but that is quite common. Uh, Actually, that is expected for any after any vaccination. When you were a child, we have tolerated lots of vaccination, and we have got fever also after vaccination, so that is expected there. But that distress is much less compared to actually you get COVID infection. So bearing that in mind, this their little side effect is expected to occur, but that is actually proving that the vaccine is working.
I hope you found this video helpful. Please share this video as much as you can so that the correct information reaches the maximum number of people. Also, make sure to subscribe to Foster Feed and hit the notification bell so that you do not miss the third episode, which is coming up next Saturday. Until then, stay safe, stay healthy.